Hi everyone, I'm Dr. Evelyn at Petsadena Animal Hospital. Let's talk about heart disease. Heart disease can be more common in some pets than others. Certain breeds and age groups are more likely to develop heart disease. The most common age group that's diagnosed with heart disease are senior pets. However, puppy visits are very important because if it's a congenital issue or issue they were born with or inherited, we can find signs of heart disease during our examination. We can break heart disease down into two major categories. One category would be congenital heart conditions. This is where a puppy or kitten is born with a heart abnormality, and some breeds can be more predisposed than others. However, every pet should be screened for a possible heart murmur, which is an abnormal heart sound that can indicate potential congenital heart disease. The second category is acquired heart disease. That includes degenerative heart disease, which typically occurs in older pets as components of the heart start to break down due to age. Acquired heart disease also includes heart disease associated with a nutritional deficiency. This can occur when a pet is given a diet that's not nutritionally balanced and doesn't have the right nutrients to support normal heart health. Let's quickly talk about degenerative heart disease, or heart disease we tend to see in older pets. In small breed dogs, the heart disease we tend to see the most is a heart valve issue. Typically, that'll lead to a leaky heart valve that will then lead to more advanced heart disease. We can discuss that further during your visit. In large breed dogs, we tend to see a condition called dilated cardiomyopathy, where the heart muscle becomes thin and doesn't pump as effectively. We can discuss that more during your visit as well. Part of our assessment of your pet's heart health is to auscultate their heart and lungs. So we listen to the heart and lungs with a stethoscope. That allows us to listen to the heart for unusual heart sounds like a heart murmur or potentially for an abnormal rhythm or an arrhythmia. We also listen to the lungs to make sure we don't hear any congestion in the lungs that could suggest congestive heart failure or advanced heart disease. If your vet hears a heart murmur or arrhythmia, then that will typically prompt them to perform more diagnostics. Now let's talk about some of the signs of heart disease. Heart disease can be characterized by a number of different signs, some of which may be obvious, like coughing or breathing more labored or faster when they're resting. Some may not be as obvious, like being more tired and more winded after exercise. With advanced heart disease, your pet may even experience episodes of collapse, or what we call syncope. Diagnosing heart disease is very important. When your pet comes to Petsadena, we will perform our thorough physical examination and then we'll discuss additional diagnostics based on our examination. Your vet will usually recommend taking x-rays of the chest to assess the heart and lungs, performing a blood pressure check, potentially checking a blood test that looks at heart health, and possibly performing an EKG to check your pet's heart rhythm. Even after performing those diagnostics, your veterinarian may also recommend that we refer your pet to see a heart specialist or cardiologist that can perform the ultimate diagnostic to assess heart health. It's called an echocardiogram or an ultrasound of the heart. That allows us to see your pet's heart size, look at the structures within the heart, assess the cause for a heart murmur if there is a murmur, and also assess the heart's function. Depending on the results we find on those diagnostics performed, your veterinarian may recommend medications for your pet's heart. We usually will prescribe medications to either help with blood pressure if there's high blood pressure, medications to help the heart pump more effectively, or medication to remove fluid from the lungs. It all depends on the stage of heart disease that we're able to determine based on our diagnostic results. Because heart disease can develop quickly, it's important for your pet to be seen routinely, especially if they're an older pet. Every 6 months is recommended because we can find murmurs in those timeframes. It's equally important once your pet's diagnosed with heart disease to schedule routine visits for your veterinarian to assess your pet's response to treatment and to assess for progression of their heart disease. Diagnosing heart disease in the early stages is extremely important and improves the outcome when it comes to treatment. If you think your pet's showing signs of heart disease, make your appointment today. Thank you for choosing Petsadena.